think that to ignore the reality of unconscious or conscious bias is to ignore uh, a great deal of the factors around diagnosis. And I think it's not unknown to doctors that if you have an X chromosome, you will as women do, the extra X chromosome, that you will be likely someone who will have a likelihood of an autoimmune disorder. Now, my disease is not autoimmune, but I call it like it's like the next door neighbor to autoimmune. It's a complement disease, and the
Okay.
complement helps the immune system. So it's very similar. But I do suffer, honestly, from vitiligo, which is one, and psoriasis. And that already occurred in me before this dramatic diagnosis.
Okay.
But I think that the factors are like, even if doctors know that to be true, I think there's a lot of need for training around when a woman comes in talking about symptoms. And I can use my own experience as like I came into an ER talking about pains in my stomach. A woman having pain in their stomach, it's not always something that's going to flag. And in fact, I was reached out by a few folks that said, "Oh, I had the same thing. I went to the ER. I was sent home. I had to call 911 to be taken seriously," which is, you know, pretty extreme.